Hi, welcome to the Trauma Thrivers podcast. Delighted to have you with us. I'm Lula Bentz, your host, a psychotherapist, a trauma expert, and a survivor myself. Lovely to have you with us. The Trauma Thrivers podcast is for anybody who has been through any sort of developmental trauma or who has complex PTSD. This podcast aims to help educate, inspire, and support those of us that are on a trauma healing journey. We've got stories, steps, and various solutions to trauma to help you heal. If you'd like more information or tips or tools or strategies, please go to traumathrivers.com. You can also find this podcast on my YouTube channel, Lula Bentz Trauma Thrivers. If you'd like to join our community of thrivers, please find us on Facebook under Trauma Thrivers. I'm delighted, absolutely delighted, to introduce our guest tonight, one of whom I've known for quite some time, Dr. Wayne Kampers, and Laura, his wife, for less time. But I'm just thankful of you both coming here and speaking to the audience and talking to us about what you're up to and chronic pain and trauma. So thank you.
Oh, thanks, Lou.
No, thanks, Lou. Thanks for having us on. Yeah.
Oh, delighted, absolutely delighted. And just for some of you thrivers that are watching, Wayne and I have worked together for many years, and I'll let him explain a bit more about what he does. But I would say I'm going to embarrass you, Wayne, but he's got to be my favorite psychiatrist that I've ever worked with ever. So yeah, the highest recommended ever. So there you go.
Oh, that's praise indeed. Thank you.
Really is.
Oh. So where should we start? Should we start a bit with, would you mind introducing yourselves just a little bit and what you do and why you're here?
Yeah, absolutely.
So I'm Wayne Kampers. I'm a consultant psychiatrist. I've been practicing medicine for over 30 years, and I'm based in London. I have a Harley Street practice, and I'm a consultant at the Priory Hospital in Roehampton. Obviously, with lockdown, I have been working remotely, but I'm in the process now of doing a hybrid return to London. And one of the reasons why we wanted to come onto this program with Lou is, and I've worked with Lou for a very, very long time, and I'm gonna return the praise. Lou is without a shadow of a doubt the best trauma therapist I've ever met. Oh. And I send all of my clients to her because I trust her, and I know that all of my clients are in safe hands. And so we've got a very good working relationship in respect of that. One of the things that has always interested me is the whole mind-body connection, because I don't think this is something that is addressed well in Western medicine. I think Western medicine is excellent in terms of focusing on aspects of the body, surgical procedures, all of they're exact. It's a very exact science. Psychiatrists are purportedly good at focusing on the mind, but there's a huge gap, and that is the connection between the body and the mind, because everything is connected. And if we look at Eastern medicine and see how good they are at that, and Western medicine, how good they are at certain things, I think these two cultures need to meet and marry each other, because until they do, there's always going to be the problem that we have at the moment. And the problem we have at the moment is that there is the commonest presentation at GP practices are medically unexplained symptoms and pain for which there's no identifiable cause, okay? And so this is where my interest really lies. And I myself suffered from pain about 16 years ago, very, very severe pain, which turned out to be what we now know as neuroplastic pain. And I cured myself from that. And the journey that I've had over the last 16 years, and Laura's been integral to this, because it's been interesting to hear from her perspective, you know, what thing. But at one stage, I mean, I had three of the top neurosurgeons in London wanting to operate on me. I had back pain, okay, back pain that came out of nowhere.
Wow.
Okay, and the problem is that if you do an MRI scan of anybody's back from the age of 19 upwards, you will see degenerative changes, almost like wrinkles and gray hair as you get older, but right from a young age. And people will then attribute whatever they see in terms of the degenerative change as the cause of the pain. Right. And very often they'll go down a treatment algorithm right up to surgery, and actually their pain doesn't get better. I'll explain a bit later why. So I was at a stage where I was desperate. I literally was probably taking about 60 tablets a day to try and help my pain. And even with that, I was only managing to sleep 2 hours a night. My pain just got worse and worse and worse. I still had to work. I still had to drive to work. I still had to run my practice. I still had to see clients. I mean, I was literally at the stage of myself, I don't know what to do anymore. I've got no ideas. I'm out of ideas here. I'm all out of ideas. And I was definitely not having the surgery, because there was something that told me that there was a mismatch between where my pain was and the symptoms I had. It didn't fit. And because I was a doctor, I knew something wasn't right. So that's what I'll hand you over to Laura.
Laura, I'm fascinating. I've got so many questions I want to ask.
I know, but just in a nutshell, I'll just tell you it from my perspective. So I'm Laura Kampers. I'm a pain coach and a pain reprocessing therapist. And my interest is equal to Wayne's for the same reason that I saw Wayne go from being this strong, healthy, gym-going guy to an absolute shell of himself. And it came, as Wayne said, from nowhere. So when he was seeing these surgeons and they were recommending this really invasive, serious surgery, I had this nag in my mind, which was, well, why has this happened? Why should he suddenly go from being healthy to needing this like really terrible surgery? Then on the other hand, I had the thought of, well, where's this going to end? Is he going to end up disabled? Is he going to be able to not work? You know, where will this literally end? And we also had a young child at that stage as well. So Wayne was unable to play with him and pick him up and all the rest of it. I was desperate. My personality is one that when I have a problem, I have to find the answer. So back in the day, there wasn't Google as is now, but there were chat rooms. So I was going into these chat rooms and I was, you know, talking to people about back pain, and people kept mentioning this amazing book. I'm a book fan. So I was like, well, if there's a book that can help, let me read the book. So I read the book, and the book was by a doctor called John Sarno, who is the forefather of this mind-body work. And in very simple terms, John Sarno said, and Wayne will explain this in more scientific detail, but the pain is caused by the brain, not the body. And it's all about repressed emotions and trauma and that kind of thing that creates the pain. Well, this was all news to me, but I soaked this book up like a sponge and then went to Wayne and said, I have the answer, Wayne, and it's in this book. And he obviously looked at me as if to say, are you mad? As if a book can help me. I'm a psychiatrist, Laura. I think I'd know about this. And I was like, well, just read the book, Wayne. Please just read the book. And he read the book and he did what the book suggested. And he did a lot of work around it because he's very cognitively minded anyway. He really was able to grasp what all the concepts were, etc. And essentially he cured himself. So that was like it was like a miracle, Lou. I mean, it literally was like a miracle. He came off all of his medication. He went back to doing all of the gym, everything he used to do. So that was why we became as interested in this as we are. But this is why we're passionate about it, because we've seen how it transforms lives.
Wow. And can I ask, Wayne, how long were you in pain for, and how long did it take you to find the book and find the healing and find the answer?
Well, it happened, it happened when my son, our son Nathaniel, was he was about 18 months old, and we went on a long flight to Cape Town. And back in those, well, even now, you can't buy a seat for anybody that's under the age of 2. Okay, so he had to be on our laps, and he is a busy boy. And literally, it was a long haul flight, you know, and we were like 16 hours with him on our lap. And when I got to Cape Town, that's when I got this pain in my back. So I thought it was that.
Yeah.
Okay. I thought it was completely ruined the holiday. Anyway, came back to London, and I then went. It was a few years really, because I did everything. I didn't just end up seeing the surgeons. Okay. I did absolutely everything that one could do for pain. I did, you know, McTominay chiropractics, Pilates, you know, I saw acupuncturists, I did Reiki, I did, you name it, I did the lot, everything, absolutely everything, okay? And nothing helped, just got worse and worse and worse and worse. And then I had all the investigations done, you know, and they all just, you know, but once a surgeon sees something on your scan, they'll say that's the cause.
Yeah.
I had 3 spinal epidurals, okay? The first one lasted maybe a week. The second one lasted a couple of days. And the third one lasted until I got up, as I walked out the hospital. So it just shows you whatever they were giving me wasn't actually, there was no structural problem. Because if there was a structural problem, you give a person an epidural, it treats the structural problem.
Yeah.
And that was the problem, is that there was no structural problem to treat. Okay.
Yeah.
And so that, and it was once I actually had read John Sarno's book. So John Sarno was an outcast in the medical world, because he had known this for decades and decades. And he was a doctor who worked in New York in an orthopedic clinic. And he used to see all of these people come in with chronic pain who never got better. And so he made this connection, and he realized, and he described certain personality types, and he described, you know, that people had been, you know, had trauma in their lives. And so he then wrote this book, and he's written quite a few books since, and they were groundbreaking books. I mean, to be honest with you, in my opinion, the 2 greatest contributors to the world of psychiatry ever was Freud and John Sarno.
Wow.
Those 2 people for me are the geniuses, because actually Freud identified this back in the day. It's just that the nomenclature he gave to it, we didn't really accept. And so this has been in psychiatric terminology for many, many years, but it's always been pushed right down to the sort of stress and somatoform and anxiety type of conditions. And so it just gets into the basket, and nobody really you know, has ever stood up and actually said, hang on, what's going on here?
Yeah. So how did you find it? What did you discover, or what work did you have to do to let go of the pain?
Well, let me just, I think a good thing might be first explain what neuroplastic pain is.
That would be a great thing.
So what most people don't realize is that we do not have pain receptors in our body. You don't have, there are no pain receptors in your fingers or your toes, etc. There are no such thing as pain receptors.
Wow.
Okay. All pain, and people, most people don't know this.
No, I don't know this.
So, for example, if you cut yourself with a knife, the receptors in your finger sense pressure, etc., and they send a message straight to your brain. Your brain then sees the finger bleeding and sends a pain signal straight down to your finger. So you've got to do something about this. So then you put a bandage on it, you go and have stitches put in, etc. And then the minute the brain feels that it's safe and that you've dealt with the problem, the pain goes away.
Okay.
And the best example I can give you, think about somebody that is on is skiing down a slope and fractures their femur, okay? The big bone in the top of their leg. Imagine how painful that is. Okay, so they come and they sort it out, and the person ends up going into surgery, and they have a pin put in, etc. Has anyone ever thought that once that pin's in place, or once the cast is on their leg, the bone inside is still completely shattered, but there's no more pain? And the reason for it is because the brain has decided it's now safe again. We don't need to send the pain signal down anymore. Okay, so pain is a way of the brain saying there's danger and we need to protect you. That is the purpose of pain. But there are no pain receptors. So if you put your finger onto a hot stove, it's the pressure and the burning that your brain then sends a message. Or if you drop something on your toe, okay, you will do whatever you need to do to protect yourself and make you safe. The minute the brain feels safe, it stops the pain. Okay. Wow. So now with neuroplastic pain, it's a false alarm.
Okay.
The brain is actually creating a false alarm. Okay. It's a symptom of mind-body illness, which in fact is a stress illness. Okay. So there's nothing physically wrong with the body. All right.
Yeah.
But the body and the brain, there's a disconnect. Okay. And the brain's alarm system sends a message down to whatever part of the body. And bear in mind, this is not just for pain. This is for all medically unexplained symptoms: chronic fatigue syndrome, fibromyalgia, IBS. There is a list. So anything that is medically unexplained, and they have had all the investigations done by the doctors, and they can't find anything wrong.
Right.
Or if there has been an injury, that it persists long past the healing time.
Okay.
Okay. So the normal healing time for anything, maximum 6 months.
Yeah.
So, 3 to 6 months, anything will heal. A broken bone, even a bulging disc, all of them will heal with it. Anything that persists longer than that, that's neuroplastic pain.
So why is the brain continuing to send these false alarms when there is nothing really, in essence?
A simple way of thinking about it is you get locked into this pain-fear cycle.
Okay.
So you feel the pain and you're fearful of it. Understandably, you've got this terrible pain, but because you're sensing fear, because your brain's experiencing fear, it sends out more pain. So you are locked into that pain, fear, pain cycle, and you can't get out of it.
Right.
That's basically what's happening.
And then the physical pain or the physical symptoms that you're experiencing are actually an expression of emotional pain.
Yeah.
This is repressed emotional pain that you have not dealt with.
Okay.
It's in your subconscious mind, so you're not aware of it. Your subconscious mind says, it's time to sort this out. Okay, and so it says, well, how am I going to get you to notice this? What can I do to get you to stand? What better thing to do than send you pain?
Yeah.
Everybody takes notice of pain. Okay, yeah. But of course, now it can be anything. It can be chronic fatigue as well. But this is all of these symptoms are a feature of repressed emotional pain. Now, this is where it's key, because that repressed emotional pain could be serious trauma that you've had in your life that you've never dealt with, or not. I mean, for my example, I had no trauma.
Didn't you?
No, I had no trauma in my life. I, for all intents and purposes, I grew up, I had a pretty, I mean, nobody has a perfect family. Nobody has perfect parents, but I really had no trauma in my life that I could identify. Okay. And so there really are 4 causes then of neuroplastic pain. Okay. Either a person has been traumatized in their childhood, and they're not aware of it. Okay, and that's obviously, we will come to this, that's really your field. Or they might have had an injury that just never got better. Okay, or they may actually have a very particular personality type that represses their emotions. They don't deal with their emotions. They people pleasers. They are the people that instead of, and that's me. I have the classic pain personality type of person. And when I look back now, the reason why I probably developed this pain was from all the years and years and years of just repressing my emotions and not actually dealing with my emotions at the time. But from a psychological perspective, I had no trauma in my life.
Yeah, and for some people, trauma can be literally being bullied at school. It can be going to a very high achieving school where they fell out of their depth. It can be having an overbearing parent. It can be trauma, but not in the way that we usually view trauma.
Yeah.
And most people have had something of that go on in their life.
Yeah.
And, for the brain's very good at remembering. So So, it could be that somebody went through a very shameful experience as they viewed it as a child. As an adult, the brain then starts to view shame as dangerous. So when the brain experiences shame, rather than the person knowing this is shame and this is how I deal with it, the brain immediately sends the pain signal. Don't even think about going into that shame. Let's not go there. That's dangerous. It's easier for the brain to send pain. Let me distract you from that emotion because it's too dangerous for us to go into that. And the person's preoccupied with the pain. They're no longer thinking about the shame or the, whatever the emotion is. So it's very interesting.
It's almost like,
sorry, and then just coming back to what Laura was saying in terms of, and if we think now, because you and I have had this conversation before about how there are many psychiatrists who don't recognize the whole concept of CPTSD, complex post-traumatic stress. Now, we know now that this is all relational. It's all about relational stuff that's gone on in a person's life, and the relational stuff is the source of the trauma. It doesn't have to be, the things that you would classically see in veterans with CPTSD. With PTSD, all the stuff that you would see from the war veteran. This is different. CPTSD, I think, is far more insidious and may present in people who have actually been who've had significantly negative childhood experiences, but the brain just didn't process them at the time, and so they got repressed almost into the subconscious mind. And the subconscious mind, John Sarno describes something which is called the reservoir of rage. And the reservoir of rage and doesn't have to be rage. It can almost be the reservoir of guilt or shame or any of those emotions that we're not good at dealing with. That reservoir, like a pressure cooker, it gets full, and then the lid comes off the pressure cooker, and that's when the subconscious mind sends the message primarily to the amygdala. That we know that the amygdala is the fear center, and everything is primed through the amygdala, and so that's where it then sends the message, and the message that it sends is pain. You've got to deal with this, but until you make the connection that it's actually repressed emotions that you have to deal with, your pain will never get better.
No. Can I ask a question that just comes up for me? Is it, do you think, or both of you, is it easier to focus for a lot of people on physical pain, or it to be manifest as physical pain rather than as emotional pain?
Yeah, definitely. Because a lot of people don't know how to focus on the emotional pain. They don't know how to process their emotions. A lot of people can't even identify often what the emotion that they're feeling is. So for them, it's actually easier to just, if you are in chronic pain, it's very difficult to think about anything else anyway. It consumes you. It consumes every decision you make. So you are so preoccupied with that, you don't think about, and if you did, even if you realized that it was your emotions that were driving this, where do you begin to figure that out? And that's really where we come in.
So brilliant segue, but where do people begin if they're in the similar situation, or they identify with Wayne's story, or they're listening to this going, oh, that could be me. Well, where do they start?
I think a great place to start is to read some of John Sarno's work, because that's highly available. It's cheap. Get a book, read it, and for some people, like Wayne, that can be enough, but there are other people that have a more complex issue, or they just feel they need to work with somebody. They feel they want to speak to somebody on one-on-one. They really need that structure and that accountability, and then they come and they work with us. And my kind of role as a pain coach is that, as Wayne was saying, neuroplastic pain is essentially a habit that the brain has learned. So thankfully, just as the brain can learn pain, it can unlearn it too. So first of all, we have to find the root cause of the pain. There's no point just treating the symptoms. So we have to figure out why the brain is on high alert, and then we coach around that. So I use lots of tools and techniques, including pain reprocessing, which retrain the brain how to interpret signals from the body properly. So the person is seeing the pain through a lens of danger. And as I said earlier, danger, fear, pain, danger, fear, pain, how do you get out of that? So I teach my clients how to see the pain through a lens of safety, and that in turn helps it to fade.
Wow.
So, yeah, so how we do that, I mean, there's lots of different ways that we do that. Yeah, we do it through somatic work in the body and cognitive work in the mind. So actually managing the mind is such a big piece of this. So I show my clients a way to look at their lives in a completely new way and through a completely new lens, which expands their mind and it leads them to new ways of thinking. Because really the only thing that needs to change is actually the one thing that we have complete control over, and that is how we think. Now, I show clients how to control their pain by controlling their thinking, which sounds very simple. And in many ways it is, but it's not easy to do.
Yeah.
Because in order to achieve that, you have to learn to really understand yourself fully. Suppressed emotions, as Wayne said, are seen as fear to the nervous system, and the body responds with pain. So it's important for the person to learn how to feel their emotions. And so I teach people not only how to feel their emotions, but also how to actually process them through. So, and I also show people how they can create the feelings that they want to feel on purpose. So essentially, becoming pain-free is a skill, and it's a skill that you can learn.
Okay.
There's a very important part of this, though, Luna. I'm just going to cut it back a bit, and that is that we need to look at the comorbidity between post-traumatic stress disorder and chronic pain, and say complex PTSD and chronic pain.
Yeah.
Now, in the same way as anybody that is suffering with pain in their body must always be seen by a medically qualified doctor to exclude that there is no organic cause for the pain. Okay, there must be, and all those tests need to be done first. And I mean, there's lots of ways and lots of clues that suggest that it can be neuroplastic, and that's a whole nother topic, but they must always be seen by a doctor. Secondly, if a person has got PTSD, okay, and particularly the type of PTSD that you deal with, they must be seen by a PTSD specialist first, because the type of work that you do with people is that they are, you know, people who are experiencing severe flashbacks and actually have got very severe trauma in their life, and that must be properly processed by a specialist like you first. I think if somebody comes to us that has severe PTSD, I would always say, I need you to see a PTSD specialist first, okay?
Yeah.
And the reason for that is because there is the research shows that there's a very strong link between complex PTSD and chronic pain, okay? Right. The research actually shows that they are both, there's a close interdependence of symptoms, and people who've got both, their pain is actually worse.
Yeah.
With complex PTSD and pain, their pain is worse than people just with chronic pain alone.
Yeah.
People just with chronic PTSD. And also need to make sure that the pain they're experiencing is not as a result of the trauma. So, for example, you know, let's say they were sexually assaulted, etc., and they've got pain that actually might have an organic cause. That really does need to be excluded first. It may not be. What I'm trying to say is that, you know, it's about making sure that the person has got the comorbidity treated properly, because that could end up being quite a rate limiting step in terms of the work that Laura does, you know, with somebody. It might be this person, I feel a bit stuck, and invariably it's because there's a comorbidity that has to be looked at. So we're very clear about that, is that that people must have their trauma. For somebody like me who hasn't had trauma, okay, I'm then the ideal candidate for that, because, you know, where they can get to the place I need to get to quite quickly. But if somebody's very traumatized and has got a lot of stuff, they need to be seen by a specialist in that field, like yourself first, okay? And then it may well be that you actually are able to really treat their trauma very, very well. And then you could say, but the pain's not sorted out yet, and then we need to look at this pain as well.
Yeah. That makes a lot of sense, because I think what I'm hearing is almost, we're doing quite a similar job in a way, in that it's the mind-body reconnect, it's the reframing parts of us that are sending us signals, maybe as intently there to help us rather than to harm us. They're kind of protecting us.
Yeah, because that is the thing. Sometimes people will say to me, why is my brain doing this to me?
Yeah,
it's exactly that. Your brain is protecting you. Your brain thinks it's doing you a huge favor here.
Yeah. And not only does it think it's doing a huge favor in protecting you and sending this constant signal, it's keeping you away from all of that stuff, which quite frankly is overwhelming to a lot of people.
Yeah, and also if it's something that happened to somebody when they were younger, the brain still thinks that you are that incapable child, that you know, didn't have your own agency and couldn't look after yourself. The brain hasn't caught up with the fact that you're now an adult, and you know, so it's really interesting.
I think another real key part is the work that Laura does, and she did mention it earlier, and you know, I'd like her to expand a bit on that. It's not just about helping people become pill-free, pain-free, back to exercising. It really is about actually getting them. The whole neuroplastic pain is obviously a learned neural pathway in the brain, which can be unlearned. Any new habit that you form, and we know this now from neuroplastic change, with the advent of imaging and the advent of that it takes about 3 months to really learn a new habit. We know this from people who play musical instruments or learn a new language or exercise, etc. And so that habit has to be, you need to do it every single day. Okay? So if you think about, for example, some of the principles of CBT, etc. The problem is that once people have done CBT and they've had their anxiety treated or their depression treated, they go back to their normal life. They don't use those techniques anymore.
Yeah, but I often have people say to me, I just want to go back to how I was before. And I say, no, you absolutely don't want to go back to how you were before, because the way that you were before, the way you were living your life, the way that you were thinking was the reason that you actually got this problem in the first place. So the great thing, kind of the meta thing about this whole work is, once people are not only pain-free, they're also able to be in the world in a much better way. You know, they can relate to themselves better, they can relate to other people better. They've dealt with the things like people-pleasing, perfectionism, the things that have actually aided them becoming getting into pain. I can't think what the word is.
In the first place.
In the first place, exactly. So that is the thing. It's like understanding that the way that you were before was actually part of the problem.
And if you think about that neural pathway that's been learned, that pain pathway that's been learned, okay? So you're not only going to unlearn that pathway, you've got to learn a new pathway. But in order to really solidify that new pathway, you've got to bolt things on and learn other new neural pathways. So you almost go from an old habit, single lane, you're now going to build a new neural pathway, almost like a super highway. And so that doesn't become your default setting. You're not going to go back to your default setting of your old ways of thinking. So there's lots of techniques that you do, which you add on, and it's got to do with nutrition, it's got to do with exercise, it's got to do with all the positive things that create new neural pathways, meditation, the way you breathe, what you eat, all of it is connected, because what you're doing there is you are creating a new neural pathway. And we know this from all the studies that are done on addiction, okay? Because addiction is in essence a habit that is learned from a neural pathway that forges very, very quickly. And the reason for that is because we live in a dopamine-driven world. Okay, everything is about, let's get the dopamine hit, let's get the dopamine. All addiction is a dopamine hit. All that pathway gets forged very quickly. Pornography, sex, alcohol, drugs, food, Instagram, social media, all of these things can actually prove to be addictions, and they learned very quickly because you're getting your dopamine satisfaction. Sugar is one of those. I mean, you know this, in terms of that. So what you've got to do is you've not only got to unlearn those, but you've got to actually form new neural pathways that wire together. There's a principle in things that says that neurons that fire together wire together. So you've got to get a new neural pathway, and you've got to practice it and practice it and practice. So all of a sudden that becomes your new pathway. Okay, and once you get on that, then you can do anything in terms of that, because the real key there is you're back in control. You're back in control of your thinking. You're back in control of and if you can control your thinking, then you're in control of your emotions.
Yeah. I agree with you. And I'm just thinking about the link between the neural pathways and the kind of mind body, and what's cognitive and what's somatic, and how much of this disconnection, because you know how I view addiction, Wayne, a bit like Gabor Mate. You know, it in a way it's a bit like pain. It's an attempt to disconnect and repress and shut off actually what's going on in the system,
not deal with your emotions.
So I wonder, in the retraining of the neural pathways, how much of the somatic, how much of the work is staying with the pathway into the body and into the feeling and being with it and being okay with it.
Yeah, exactly that.
Well, that's a key part of the processing of emotions.
That's a big part of the work. It is the processing of emotion, and it is understanding, like you say, that most people avoid their emotions altogether, or they react to them, or they resist them, but they don't allow them because they believe that it's dangerous to allow them. You know, if you have got a very powerful feeling of fear or shame or whatever that feeling is, we know that that doesn't feel great.
No.
So we assume this should be avoided. You know, I need to get rid of this feeling. I really need to get rid of it as quickly as possible. When the truth is, we need to move towards it. We need to experience it, and we need to understand that it's safe. And we need to send that message to the brain that I can feel this feeling. I can have this emotion. I can work through this emotion, and I am safe. And interestingly, it's very similar to the somatic work that we do on pain. It's experiencing that pain, but through a lens of safety rather through a lens of danger. And it's showing the brain constantly, this pain is not dangerous, and I can experience this pain in a safe environment, and I know how to do it, and I can keep reiterating the message to my brain that I am actually safe. That's exactly the work.
And we in the Western world are conditioned and taught from a very young age that there are certain emotions that are unacceptable to society. You're not allowed to show those emotions, okay?
Not at all.
You know, the way we talk to children, the way we teach children about their emotions, they are almost taught that there are certain emotions which they're not allowed to have. And so what they do is they repress them. And that's where all the problem starts, is that from a very, very young age, we are not taught how to feel, how to process our emotions. We're taught that there are certain emotions that are unacceptable to society.
And society keeps perpetuating that message as well, constantly. You know, and Instagram and all of the modern kind of things that we have show us that, you know, we should always be happy, we should always be positive, you know, we should never be angry, we should never be fearful, don't be anxious. And, you know, we lose sight of the fact that we as humans are meant to experience all of these emotions, and they're not dangerous. And because you feel angry, that doesn't mean that you're going to walk over and punch somebody. You can feel angry, you can experience anger in your body, and it be a very healthy experience. Understanding that.
I think, and one of the things as well is the sort of, if Laura can elaborate a little bit on sort of the 50-50 rule about life, okay? Which is just... the
fact that, you know, we as human beings are not supposed to be happy all the time. That's not the goal. The goal of being a human is to feel and to experience. And in order to do that, we have to experience all of the emotions. And in life, we will always strike a balance of 50-50. No matter what the circumstances we find ourselves in, life will always be 50-50. 50% of the time, we will be experiencing what we deem to be negative emotions, and 50% of the time, we'll be experiencing positive emotions. And that is normal. But we have been conditioned in our society to believe that if we're experiencing any of the negative emotions, something's gone wrong.
Yeah.
You know, something has gone wrong. We don't accept nothing's gone wrong. This is just part of the deal. If you want to be a human living in this world, you are sometimes going to feel this emotion, and that's okay. And the reason that that's okay is because it's safe. It's safe to feel every emotion.
Yeah.
Mm.
God, what a different world it would be if everybody could feel. I mean, how do we teach that? I know that we all teach it as a living, and we all believe it, and we all want to process and be with our emotions. And that's what I know you guys do and I do. But how do we teach that out there? How do
really
we?
hard. It's
Yeah.
really hard because we're up against it with society and the way that the world's kind of set up. And I think that the sad thing is that people often don't find our work, yours and our work, until they're desperate, until things have gone wrong. And that's a shame. You know, it's a shame that we aren't taught this at school. That would be where we should learn it as children. But we don't. And as Wayne said, if anything, we're taught, don't go there, avoid it.
Yeah, and I think we you know, if you think about Western medicine, there is no such thing in Western medicine anymore as a preventative model. Okay, it's all a chronic disease model. Okay, it's like, once you've got the problem, how do we try and sort it out?
Or manage it, not even sort it out.
The greatest health burden at the moment, worldwide, by far, is chronic pain and medically unexplained symptoms. It's responsible for the opioid crisis in Australia, responsible for the opioid crisis in America, where there are millions of people that have neuroplastic pain that are addicted to opiates.
Yeah.
And there's no hope in sight for them until it can actually be recognized, actually, this is neuroplastic pain, and we can get you off opiates, and you can actually come off this medication, not all at once. Of course, that needs to be supervised by a professional, but it's an enormous problem worldwide.
But also, without getting too political, there's no real money in teaching people to meditate and to feel their emotions, etc., where there's a lot of money obviously to be made in pain medication. So you're always going to be fighting that as well. And also in our society, where we kind of want instantaneous results, whenever anybody has a pain, they don't necessarily think, let me go within, they go straight to the doctor and say, can you give me a pill? I just want to get rid of this. So we've been conditioned to kind of respond to that whenever we have a problem. And the medical world, as Wayne said, although they do so much good, they are very willing to say, take this pill, take that pill, rather than look at the bigger picture. So that's difficult as well.
It's a similar mission, really, I think, to where I'm at, in that, I might call it trauma, and it comes out sometimes of trauma, but trauma and chronic pain, if we took that as a kind of worldwide issue, everybody needs to be trained in it. And Wayne, that I say you're one of the only psychiatrists I know that does that whole integration of mind and body, but there are lots of psychiatrists out there that aren't like you, and lots of GPs and lots of other health practitioners.
Yeah, I mean, I think that unfortunately that is the case, but I do think that, and this for me is a real key part of it, is that the more people can start recognizing this real mind-body connection and recognizing that the problem that we have is that Western medicine and specialists are so organ focused that if you go to them with a symptom, they want to help you and they want to get you better, and so they will go and look. They have to find a cause. They're not happy with no cause, but of course, a lot of the times it ends up being a medically unexplained symptom, or and ends up in this whole chronic model of people who are the disability, and then the amount of time spent of work and how it completely ruins their lives, because that and of course what the biggest irony is, what specialists and doctors end up saying is they put them into that basket of it's all in your head. Which of course it actually is.
Ironically.
Well, partly in your head, but partly in your body too.
But they just say, and I think this is where the psychiatric world has always gone with the premise that anybody that's suffers with any sort of somatoform disorder, and neuroplastic pain is actually somatoform pain. It's chronic somatoform pain. That there has to be something psychologically wrong with the person, because they also put it into the same category as somatization disorder, factitious disorder, malingering, all of those conditions.
So negative.
And the premise there is that people are intentionally creating these symptoms because they're looking for attention. Okay, when the irony is, your brain is trying to tell you there's a problem that you need to deal with, and so it's intentionally giving you a symptom so that you can address it.
But you know, the issue is, and the problem is, that if you go and see a specialist with a pain in your foot, or if you go and see a specialist with a pain in your shoulder, or burning mouth syndrome, or one of these kind of strange things, nobody's going to say, oh, you've got a pain in your foot because of stress or repressed emotions, which is actually the truth. But there's just that connection just isn't made. As Wayne said, the doctor is going to try and find what is wrong with this foot. Let me look at this foot. We'll do so many investigations into this foot or whatever part of the body it is. And it does seem for a lot of people a stretch. People can accept things like, I've got a stomach ulcer because I'm stressed. People can make that connection, which is exactly the same neuroplastic process. IBSP, you know, there are some things that people can accept as stress. Headaches, people can say it's a stress headache, and they accept that. But if you've got a pain in your toe, or something or cystitis, you know, something that, and there's no medical reason for it, people don't always make that connection, and it can be a stretch. And sometimes for the actual medical professional, they can be like, no, you know, if they're not trained in it.
And of course, they've created organizations that have a whole lot of criteria. So, for example, fibromyalgia, okay, chronic fatigue syndrome. There are now organizations who say this is a recognized condition, but what they don't actually say is, okay, well, how do you get better from it? And so these people, you know, people with fibromyalgia suffer often for their whole lives without any real
they're given a life sentence.
They're given a life sentence because they're given the diagnosis of fibromyalgia or something like chronic fatigue syndrome, which are all of these syndromes are actually end up being almost these medically unexplained symptoms that fall into the mind-body realm and mind-body connection, and these are stress illnesses. Okay? And I mean, I reiterate again, always, we need to always make sure that we exclude physical conditions, because there are some physical conditions which just they are not neuroplastic pain, and you know, certain pain conditions, and any pain that's caused by an organic cause, you know, a structural cause.
I would say, on the whole, would you agree, Wayne, that the people that find us have usually had every investigation by every kind of specialist? You know, they're at the end of the line, and they kind of come to us and they're like, I just don't know, what do you think, could it be? You know?
And you know, of course there are lots and lots of different symptoms that can be neuroplastic, but the commonest ones by far, back pain. And back pain, of course, is the real curveball because of what they see on an MRI scan. And the other one is pelvic pain in women. Okay.
Oh, wow.
Pelvic pain in women, for which there's no explanation. Okay. And they might have gone down the endometriosis line. They might have gone down, and actually it ends up being that they have no medical cause for that, and that includes the interstitial cystitis and vulvodynia and all of the conditions that in fact are neuroplastic, and there's no organic cause for it. If you've got an organic cause for pain, it's there all the time. It's there all the time because there's an organic cause for that pain. So until that organic cause heals.
Actually, it'd be useful to talk to that about how neuroplastic pain presents in terms of it coming and going, that kind of
and that's the whole thing. The key really is, we know what the healing times are for almost every condition. Okay, then you have this whole group of people where that doesn't fit. It's gone past the healing time. Okay, It may well be that it is not symmetrical pain. It moves around the body.
Okay.
It's very often related to times when they are stressed or something that's going on in their lives. It doesn't respond to any intervention. Medication doesn't help. There might be a slight placebo effect with an intervention. They might get temporary relief from it, but it's typically the type of things that can often be asymmetrical or can be symmetrical. They move around. They don't fit a pattern of what you would expect something to be if it was organic.
So for example, something as random as having pain in your ankle, and then somebody says, well, I've actually got pain in both of my ankles in exactly the same place. Why would that happen structurally? That's very odd. And then they'll say, but some days it actually moves to my knee and then it moves back to my ankle. Or sometimes it moves to my shoulder, somewhere completely,
different.
Or even things like I have this pain, but I only get it at lunchtime. Or I only get it when a particular TV program comes on. Literally, people will say that when I had one client, whenever there was any kind of argument or aggression on a TV program, that it would trigger their pain.
Wow. I wonder what memories that was triggering for them.
We had one client that had taken his son to a doctor because he had developed some breast tissue, and the doctor had actually said to him, we think that we have to do all the tests, but we think this could possibly be breast cancer because men can get breast cancer.
Wow.
And the minute the father heard that, his arm went paralyzed.
Yeah. And remained so until his son got an all clear diagnosis, and his arm was fine again.
Yeah.
Crikey.
Yeah.
What the brain do is incredible.
Yeah. And wasn't it Freud that you mentioned earlier did say the body is the unconscious mind?
Exactly. And I mean, Freud, I mean, he got bad press for things, and we all know about that. But when you actually look at all the sort of real positive work, and he spoke about this, without having any investigations available, without having any imaging available. John Sarno also at that stage didn't really have the imaging available that could show neuroplastic change. It wasn't until really fairly recently, with the advent of functional imaging, and with the changes in epigenetics, and with all quantum physics, all of these groundbreaking things, that all of a sudden what we recognize is that our brains aren't actually hardwired. You're not just born with hardwiring, that in fact our brains are very dynamic and undergo neuroplastic change all the time. In a negative way. So addiction, neuroplastic pain, these are all the negative sides of neuroplastic change. But the unlearning part and the positive side is that you can also create neuroplastic change in a positive cycle as well. But it has to be practiced day in, day out, and the minute that new neural pathway is formed, that's when all of those symptoms resolve. Can
I just ask one last question? How much of it is the somatic release or the somatic processing of that repressed emotion? And how does it come up when you see it with clients? How did it come up, Wayne, for you?
It's different for different clients. And I think what you need to do is you need to be aware of the fact that some people, for example, might be difficult to do somatic work with, because they might not actually be in pain at the time that you're trying to do it.
It's an interesting question, because I had one lady that I was working with who had pelvic pain, and she was an older lady, and she'd had this pain for
50 years.
But whenever she came to our sessions, whenever she came to our sessions, she felt so safe and found the sessions so cathartic that the pain actually wasn't there.
Yeah.
So to do the somatic work on her body was very difficult.
Yeah.
But what we did with that lady was we actually taught her the skill of how to do it, so that when she did feel the pain, she could do it. But we were able to work on her cognitively. And she was able to evoke emotions somatically, so we could work with them.
Yeah.
So yeah, each person is different.
And I think as well, I mean, often because people will say, oh, okay, well, I've got these repressed emotions, how do I get to them? Okay. Now, of course, in the type of work that you do, you will access, as you've always said to me when you're treating your clients with chronic trauma, it's like peeling the layers off an onion. Okay. And that's exactly what you do. We have techniques as well that people can work on themselves, where they can actually access those repressed emotions in a way that they don't actually need to deal with them and examine them and explore them, because if they are that traumatic, they should be seen by a trauma specialist. But if they're not, then actually what they're doing is they're able to bring those emotions from their subconscious mind into their conscious mind. Okay? And then actually feel it and sit with that emotion and say, well, actually, these emotions are okay. And so in a way, they're almost purging themselves of those repressed emotions in a way that they can do through various processes that we teach them.
Yeah, lovely. That reminds me of lots of processes of just going into the body and staying with it and allowing it to come up. And I suppose Juliet, one of our members, made a comment about there being a safe other person for some people, because some people, as soon as they're around, like this lady with the pelvic pain, a safe, regulated nervous system, they come out of sympathetic and their cortisol and adrenaline firing, and they can come in, can't they, a bit more to their adult.
Yeah, and that's why people are so everyone is unique, and it's about understanding why their fear center is on hypervigilant mode. And if you can, and if you can just move their fear center out of hypervigilant mode, and it may actually be that, so for example, in my case, right, it may actually just be to recognize that, in fact, being a people pleaser and being highly conscientious and being highly self-critical and being all of these things and putting the needs of others before myself, that in fact, I wasn't serving myself very well in that respect. And so, I was repressing a lot of and it can be something just as simple as that. And so it's about recognizing that, and then think other people might, then there's a whole lot of other stuff they need to do as well. And so this is the journey that, Laura and I have been on, over years now, and realized that, because we've looked at we looked at every single, pain program worldwide, okay? I saw exactly what everybody was doing and thought, hang on, but they're not doing this. Hang on, they're not doing this. Hang on. We need to see, because you're always going to be faced with people, well, that's not going to work. Maybe pain reprocessing doesn't work. Maybe somatic tracking is not working. Maybe physics are not. And what do you do then? Okay. And that's where I think the real key is about the thought work. The thought work is absolutely crucial in this process. And a lot of programs don't really focus on that, and that's absolutely crucial.
Key, but I think also, just lastly, because I know we're running out of time, I think what's really unique about our work together is the fact that you have got a mind-body doctor specialist and myself as a pain coach. So the person's able to work with us on a one-to-one basis. That on its own is unique.
And I think as well, people feeling that they also are in safe medical hands makes a big difference. And I think that is, to some extent, something that we really realize, is that when it comes to pain, people they do sort of want to hear from a doctor as well, that their pain is actually, their pain is not due to a structural cause, etc. I think that's very reassuring for people as well.
Well, it's that connection and that safety and that relationship and that relational piece
Trust.
that we all need for healing, really, don't we?
And also knowing that you've got to really look at the comorbidity as well. So if we're going to see somebody and I think that they are very severely depressed, treat that first.
Yeah.
Somebody is very, very anxious and does require medication, we'll treat that first, okay?
Yeah.
So it's very, very important to identify the comorbidity and see that sometimes it's going to take some other techniques first to get the person to a place where their brain can even start to feel it. In the same way as when you and I work together, Lou, you will sometimes say to me, Wayne, I'm right at the cusp here, but I need your help here in terms of just quietening the person's amygdala down, and getting to feel a little bit safe, and then of course that's where we work together and get the person to the place where you can then safely work with them. So it's not dissimilar in many ways.
Yeah, no, that makes a lot of sense. So guys, where for you now? What do you want? Where do you want to take this? What's the future looking like? And how do people get in touch with you?
Yeah, well, through this work and through Wayne's work and my work independently, we decided to marry our skills and, we created the pain recovery program. So that is what we're passionate about. That's what we wanted to kind of be able to get to as many people that are suffering. And don't be tricked by the name, even though it is the pain recovery program. We cover all the things that we've discussed. So anything that's medically unexplained, chronic fatigue syndrome, also fibromyalgia, IBS, all of these things, and the other things that people have that are odd and they just don't know why they have it. So we have a website, which is www.thepainrecoveryprogram.com.
Great.
And on there, it's got our bios, all about the program, what we do, etc. And if people are interested and they would like to contact us just to see if they are a candidate for neuroplastic pain, or to just ask any questions to find out anything else, they can reach us through the contact page on the website.
All right.
And we always, and I mean, our approach is always, we are very open to people contacting them through that page and just exploring, could I have this condition?
We can have a chat. Let's have a chat. What's going on? We'll tell you whether we think that what you've got is neuroplastic and if we can help you, for sure.
And by the same token, I mean, if somebody, we can assess through that as well, is that if we feel that somebody actually needs something else treated first, then I'll identify that and say, I think you need to see, for example, yourself as a trauma specialist, or we might need to treat your depression or treat your anxiety, etc. So that's a very important part of it as well, is that you've got the not only the medical backup, but you've got a psychiatrist who understands the comorbidity,
which is huge.
I think that's a real key part as well. So the person feels like they're in a safe pair of hands.
Yeah, I agree. Guys, thank you. It sounds amazing. Really good luck with it. I wish I'd known about it years ago, before my mum had 2 back operations. Literally, it would have been perfect for her, bless her. But as yet, I can't get her on the EMDR couch either. So
work in progress.
Don't work with your parents, maybe.
No, probably not.
Husband and wife was okay, but
that's very true.
Thank you so much.
Thank you so much for having us on, Liz. It's been a great conversation.
Thanks so much for listening to today's podcast. I hope it helped you in some way, and I really hope to see you back here soon. If you have anything to share on today's experience or podcast, please nip over to the YouTube channel or the Facebook group Trauma Thrivers and let us know there.